a difference by saying no to tobacco and saying yes to healthy life.
If it is introduced, there will be a total ban on the display of tobacco products at points of sale in stores, like at cashiers, and there will also be a total ban on selling tobacco products in vending machines. And selling and distributing cigarettes and vapes online and through the post and couriers will also be banned. All cigarettes and vapes will be sold in standard plain packaging. Smoking and vaping inside public places and workplaces will also be banned. And you're not even going to be allowed to vape or smoke in a way that disturbs your neighbors. And this also applies to vapes that don't have nicotine. It's a lot. It's a massive change. And if you break any of these regulations as a smoker or like a business establishment, you will face heavy penalties, including fines, and in some cases, jail time from between 3 months and 20 years.
Ke bua ka tobacco control, ke bua ka metsoko e re tlwaetseng ya kgale di-pipe tobacco, di-roll your own, di-snaife, ke bua gape le ka tse dintšha, di-vapes, di-nicotine pouches, le tse ding tsa go tshwana le bo di-heated tobacco products. Bili e ama dilo tse dintsi tse leng gore tota ka Setswana re tshwanetse re tshwaragane gore re tle re kgone go kgona tiro e tonna. Ebile re le government re leka gore bana ba ba santseng ba tla ka gore a re ga se gore ga re bagolo bone ga ba affected, mare at least bana re ka ba stopa gore ba be addicted, mare ba ba tonna le bone ba thusiwe. So se sa gore rona re rekisa bo di lost draw gore re dire lotseno ke a utlwisisa go thata mo South Africa. Batho ba na le di-challenges tsa bone tsa di-income and everything. Mme potso e one e ke kopang go e botsa setšhaba sa South Africa, a go tshwanetse go swe motho gore wena o be le tšhelete na?
Unfortunately, they failed. It is only now for government to stand up and the policymakers to stand up and say, now is the time to act. We know the data is there. The delay is politics, nothing else. The increasing availability of these flavored cigarettes and e-cigarettes appealing to the youth, low-price cigarettes, high levels of cheap illicit and hobly, and normalization of puffing. People do not understand. If you puff e-cigarette, young people do not see that smoke different from puffing, smoking, tobacco smoke. When you normalize it, you are just going to reintroduce and revert all the gains of denormalizing smoking in public places. The only solution, as I said, is standard packaging, restricting flavors, banning tobacco advertising and nicotine advertising and promotion, and use in public places.
Diseases like cancer and heart problems, and it makes us hard to breathe. It also stains our teeth and nails and affect our self-esteem. We don't want to get addicted. Some of us might start smoking because of peer pressure, stress, or curiosity. We think that it's cool or a way to fit in. But the truth is, tobacco use can control our lives and harm our health. In schools, tobacco use can affect our performance and relationships. We might miss classes due to smoking-related illness, have trouble concentrating and listening to our teachers, get in trouble for smoking on school premises, lose friends who cares about our health. As someone who cares about our generational health, I want to help stop tobacco use. I want to protect my peers from addiction, diseases, and suffering. Let's work together to raise awareness about tobacco dangers, support those trying to create a tobacco-free environment in our school and community, promote healthy alternatives like sports, arts, and counseling.
The use of tobacco remains a leading cause of preventable illness and death worldwide, and of course in our country and also in our region, contributing significantly to the burden of non-communicable diseases such as cancers, heart diseases, and especially respiratory diseases. But despite decades of progress which we have made in tobacco control, we are now faced with a new wave of challenges that require us to act with more agency and more determination and also more united. We know that as a country we've come a long way with the early legislative intervention in the early 90s, just after our democracy, which had quite a huge impact in terms of reducing the levels of smoking in our country. But all indications are that we are now on the back foot because of, as already indicated, the amount of resources which the industry is putting into advertising, using all the methods which have already been depicted here. So, as the theme of today from the WHO already indicated, unmasking the appeal, exposing the tobacco industry in terms of the promotion of the tobacco products and nicotine products. This calls on all of us to confront these strategies which we have seen, especially targeting the young people. From our researchers, from the Medical Research Council and other research agencies, indicate that there are well over 2,600 types of e-cigarette liquids, 171 types of hardware, and some of them I saw that they're being displayed outside there so that people know what we're talking about, and more than 230 e-cigarette websites which are flooding the market and luring young people with all these attractive flavors and sleek marketing.
As a parent, what can you say to another parent who's having a child who's facing e-tobacco addiction?
Well, that child needs support to start with. They need a lot of support, a lot of counseling, because it's a very difficult addiction, not easy. As somebody who has gone through that route many years ago, I know that it's a very difficult one. So parental support, if a parent is aware, they need to encourage the child, make them aware of the fact that this is a very deadly habit. It's got serious health consequences, and they need to be supported to make sure that they can work in together and develop a program through which they can ultimately quit. One thing which I can tell them will be that it doesn't work to say do it slowly. Unfortunately, the only thing which works, once you're able to win over the mind of the person to say that they get convinced that they must stop, it will be hard. They need encouragement, but it's just a complete stop.